Skelaxin, also known as metaxalone, is a medication used to treat muscle spasms and pain. It is typically used in combination with rest, physical therapy, and other forms of treatment. It is important to follow the prescribed dosage and take Skelaxin at the recommended times for optimal results. Make sure to consult with your healthcare provider for the best timing to take this medication and the proper daily dosage for your specific condition. When taking Skelaxin, you can take it with or without food as directed by your doctor. It's important not to increase your dose or use the drug more often or for longer than prescribed, as this won't improve your condition any faster and may increase your risk of side effects. If you experience side effects after taking the medication with a high-fat meal, it may be best to take it on an empty stomach or after a light meal. The dosage of Skelaxin is based on your medical condition and how you respond to treatment. It's important to follow your doctor or dietitian's recommendation to limit your intake of tyramine while taking this medication. This means avoiding foods and beverages that are high in tyramine, like aged cheeses, dried/aged meats, and sausages, preserved fish, products with large amounts of yeast, fermented foods, most soybean products, broad/fava beans, red wine, tap beers, and vermouth. If your condition does not improve or worsens while taking Skelaxin, make sure to tell your doctor. Some common side effects of Skelaxin include drowsiness, dizziness, nausea, vomiting, and upset stomach. If these effects persist or worsen, inform your doctor or pharmacist right away. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. Most people using this medication do not experience serious side effects. However, it's crucial to seek immediate medical attention if you experience any serious side effects such as mental or mood changes, signs of infection, yellowing of the eyes or skin, unusual tiredness, dark urine, or symptoms of serotonin syndrome/toxicity. This can include a fast heartbeat, hallucinations, loss of coordination, severe dizziness, severe nausea, vomiting, or diarrhea, twitching muscles, unexplained fever, or unusual agitation/restlessness. In rare cases, Skelaxin may cause an extremely high increase in blood pressure, which can be fatal. It's important to be aware of potential drug and food interactions that may increase this risk. Seek immediate medical attention if you experience severe headache, fast/slow/irregular/pounding heartbeat, chest pain, neck stiffness/soreness, severe nausea/vomiting, sweating/clammy skin, widened pupils, vision changes, sudden sensitivity to light, or any other serious side effects. Although rare, a serious allergic reaction to Skelaxin is possible. If you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. It's important to note that this is not a complete list of possible side effects. If you experience any other effects not listed, contact your doctor or pharmacist. Before taking Skelaxin, make sure to inform your doctor about any allergies you may have, as this medication may contain inactive ingredients that could cause allergic reactions. Also, let your doctor know about your medical history, especially if you have liver disease, kidney disease, anemia, or seizures. This medication may make you feel dizzy or drowsy, and consuming alcohol or marijuana can worsen these effects. It's important to avoid driving, using machinery, or doing anything that requires alertness until you can do so safely. It's also best to avoid alcoholic beverages and speak to your doctor if you are using marijuana. If you are planning to have surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of Skelaxin, especially dizziness, drowsiness, or confusion, which can increase the risk of falling. If you are pregnant, this medication should only be used when clearly needed, so it's essential to discuss the risks and benefits with your doctor. It is also unknown if Skelaxin passes into breast milk, so consult your doctor before breastfeeding. When taking Skelaxin, there are some important things to keep in mind. First, it's essential to be aware of any potential drug interactions. This includes both prescription and non-prescription medications, as well as herbal products. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. There are several products that may interact with Skelaxin, including diet pills, drugs for attention deficit disorder, certain pain relievers, and supplements. It's important to discuss any medications you may be taking with your doctor or pharmacist. Additionally, there is a risk of serotonin syndrome/toxicity if you are taking other drugs that increase serotonin. This includes certain antidepressants, migraine medications, and street drugs. Make sure to inform your doctor if you are taking any of these medications while using Skelaxin. Finally, it's important to be cautious of other products that may cause drowsiness when taking Skelaxin. This includes opioid pain relievers, alcohol, and certain medications for sleep or anxiety. Always check the labels on your medicines and consult with your pharmacist to ensure safe use of these products while taking Skelaxin. If someone has taken too much Skelaxin and is experiencing serious symptoms such as passing out or difficulty breathing, it is important to seek immediate medical help. In the U.S., you can call the local poison control center at 1-800-222-1222, while in Canada, residents can call a provincial poison control center. Symptoms of Skelaxin overdose may include severe drowsiness. Remember, Skelaxin is prescribed specifically for your current condition. It should not be shared with others, and you should not use it for any other condition unless your doctor tells you to do so. If your condition changes, your doctor may prescribe a different medication for you. If you forget to take a dose of Skelaxin, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take double the dose to make up for the missed one. It's important to store Skelaxin at room temperature, away from light and moisture. Avoid storing it in the bathroom, and make sure to keep it out of reach of children and pets. When it comes to getting rid of Skelaxin, it's best not to flush it down the toilet or pour it into a drain unless instructed to do so. Instead, you should properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.